Hi,
Hi, how are you?
I'm well. How are you?
Good. My name's Natalie.
Riz Johnson.
Nice to meet you, sir. I'm going to be your nurse today. I'm going to just be chatting with you about a couple things.
Sure.
I'm going to take a seat next to you. Let me. I see that my assistant has helped you find your room.
Yeah, very sweet.
Sorry about that.
No, that's fine.
It's nice to meet you.
Likewise.
Tell me a little bit about what has brought you into our clinic today.
Sure. 2 months ago, I suffered a heart attack, and I know they put some stents in me and all that. But of recent, I've been suffering shortness of breath and swelling in my legs.
Oh, I'm sorry to hear that. I know that that can be very hard and frustrating.
Yeah, definitely.
Well, I'm going to kind of start off a little bit about kind of how our meeting today will go. I'll kind of start off. I'm going to do a full head-to-toe assessment on you.
Mm-hmm.
And then I will talk to you a little bit about, so we like to look at not only just you as a physical person, but like a little bit about your emotional and mental health as well. So
Okay.
I'll be asking you more questions here in a little bit about that.
Sure.
And then after I do my assessment, I will go chat with the doctor, let him know everything that we talked about. He'll be in. He'll talk to you more about things. And then after the doctor's done, I will come back in and give you like your discharge instructions and kind of recommendations before going on with the future.
Okay, you bet.
Perfect. Well, great. So I'm going to go ahead and just kind of start your head to toe assessment.
Okay.
If you have any questions along the way, please let me know.
Sure.
So I'm going to kind of just start by looking at your head and your neck.
Okay.
I do apologize. My hands are cold, but they are clean.
Okay.
So any issues with your ears that you've noted?
No.
Great. Glad to hear that. Any neck pain?
No.
Great. I'm just feeling here to make sure everything's feeling okay. Good. No neck pain of recent. Any issues with drainage in your nose, things like that? Any any issues with your eyes? Good. I'm glad to hear all of that. So I've already asked you your name. Can you tell me your date of birth?
I'm 45.
You were 45. Excellent. What month were you born in?
January.
Great. Happy birthday month for you. Well, last month, I guess. Can you go ahead and tell me what city you're in right now?
Portland, Oregon.
Excellent. Perfect. And I know we're sitting here having this conversation, and it's weird to have those questions asked, but we always like to make sure we have full pictures that everybody's oriented to what's going on.
Sure.
You told me a little bit about why you're here.
Mm-hmm.
I'm going to shine a bright light in your eyes, and I do apologize. It is bright.
Okay.
I'm going to check for pupil regularity, making sure they're equal and all of that.
You bet.
Okay, bright light's coming in. Excellent. Excellent. Your eyes are equal and reactive to light, which is something we always like to see.
Super.
Can I have you give my hands a nice big squeeze?
Oh, sure.
Excellent. Can you pull your hands towards you?
Sure.
Great. And push away. Great. And I'm going to come down to your feet now.
Okay.
Can you push on my hands like you're driving a car?
Yeah.
Great. Can you lift up towards the sky?
You bet.
And can you pull down towards the ground? Great. Seems like your strength is equal all around.
Mm-hmm.
So that's good. Do you feel any differences in strength anywhere?
I do not.
Excellent. I'm glad to hear that. So moving from kind of your neurological system, let's talk a little bit about your heart, which I know that is your main reason for coming here.
Sure.
Have you had any chest pain of recent?
No.
Good. Glad to hear that. Have you had any issues? You told me you've been having issues with shortness of breath.
Yes.
Can you tell me a little bit more about when that happens and how often?
Sure. It happens when I go to bed,
Okay.
and when I'm laying down, so I prop myself up with pillows.
Okay. Using multiple pillows
Yes,
to get
exactly.
you up. Okay.
Right.
Perfect. Do you have any issues with exercise? Do you find yourself more winded and short of breath when you're moving about?
Yes, when I've walked for a while, the shortness of breath really kind of hinders me.
Okay.
And my legs.
Okay.
Yeah, it kind of hurts.
Oh, I'm sorry to hear that. I can only imagine how frustrating that is.
Sure.
Were you normally a pretty active guy?
Yes, I was. Yes, I hiked a lot.
Okay. Well, I'm really sorry. I'm gonna take a listen to your heart and lungs.
Okay.
I'll be kind of listening to one. I'm gonna listen to both while I'm there.
Sure.
This is just to make sure that I'm not hearing any extra heart sounds in there, making sure everything sounds okay. And then I'm gonna check all your pulses, making sure you're getting good flow everywhere.
You bet.
So I'm gonna ask that you just breathe nice and normally while I do this. Great. So I am going to ask you to take some nice deep breaths. I'm going to listen to your lungs.
Okay.
Excellent. Listen here. Excellent. Okay, I'm gonna 2 more times. Nice deep breath. Excellent. And one last time. Excellent. Thank you so much.
Sure, thank you.
Can you tell me a little bit about your family history with their hearts? Have you ever had anybody in your family die of a heart attack?
Yes. My father died when he was 45 of a heart attack.
Oh, I'm so sorry to hear that.
Mm-hmm.
Any other family history with
I have
vascular disease of any kind?
I have a brother who's 39, and he doesn't have any. But other than that, I don't know.
Okay, excellent. Well, I'm truly sorry to hear about your
Oh,
father.
thank you.
I'm going to go ahead and feel your pulses now.
Sure.
While I'm here. Great. And I'm going to sneak in here. Great. Your pulses feel great all around. I do see this edema here.
Yeah.
The swelling in your feet. It's the medical term we usually use is edema.
Mm-hmm.
I do, when I push down, it does leave a little indent, which is telling me that you definitely have a little extra fluid on board.
Sure.
Does it hurt when I touch anything at all?
Not really.
Good. I'm glad to hear that. Have you noticed, I'm going to kind of feel up your legs here to kind of see where it stops. Have you noticed any swelling anywhere else besides your legs?
Just my legs.
Just your legs.
You're right.
Okay. All right. Thank you very much.
Oh, thank you.
So I'm going to kind of move to your lungs. I just took a listen to them.
Okay.
They sound, I can definitely hear a little bit of fluid in there, which is what you kind of have been feeling with that shortness of breath.
Sure.
Have you had any colds of recent? Had pneumonia anytime in the last 6 months?
No.
Nothing like that? No.
No.
Runny noses, anything? Okay. Well, that's all. I'm glad to hear all of those things. So moving on to your belly. I'm gonna kind of take a quick listen to it and then feel it a little bit.
Sure.
Have you been having any abdominal pain?
No.
Any nausea or vomiting?
Not since my heart attack.
Oh, good. I'm glad. So you had a little bit of nausea and vomiting with that, but nothing since then.
Right.
Okay. And that's not uncommon to sometimes have a little bit of that nausea and vomiting when you're having a heart attack.
Right.
So I'm sorry. I know that's a very uncomfortable feeling.
Right.
Okay. So I'm going to go ahead and take a listen first and then we'll just feel. Okay. You have nice active bowel sounds, which is good. We like to hear that. I'm going to go ahead and feel. Please let me know if at any time I'm hurting you. Great. Any pain with that?
No.
Good. I'm going to kind of ask a little bit of a personal question now. Do you have, or tell me a little bit about your bowel movements. And, do you have multiple bowel movements a day?
Yes, and they're formed and fairly normal.
Perfect. So no diarrhea, no liquid stools. And when you say you have multiple a day, how many would you say?
2 or 3.
2 to 3?
Yeah.
Excellent. Excellent. That sounds good and healthy and normal. So, so can you tell me a little bit about your diet?
Since of recent, it's been mostly processed foods.
Okay.
And I'm not really sure if I could give you anything specifically.
Okay. So so if I asked you to recall a 24-hour
right, I don't think I could.
Okay, that's fine. Well, we have things that can help with that. So like a food journal. I'll bring in after the physician's done. We have food journals that I'll bring in for you, so you can start to track what your meals are.
Sure.
The concern with processed food is that they have a lot of salt in them.
Right.
And so salt can also contribute to swelling and things like that. So we can work with, I can work with you as well as we have a dietitian who works here as well. We can work on getting you kind of a good diet plan to kind of eliminate salt in your diet.
Mm-hmm.
And how about, so kind of moving from belly and bowels to your urinary system.
Sure.
How many times per day would you say you urinate?
Normal, probably three to four.
Okay.
Yeah.
Do you have any odors to your urine? Do you have any is it clear yellow? Yeah. Clear yellow.
It's fairly normal. Yeah.
Okay, good. Do you have any pain when you urinate?
No.
Good. I'm glad to hear that.
Yeah.
How much do you drink per day? How many do you drink water?
I don't really. Sorry to interrupt. I don't really like water. I drink a lot of flavored water.
Okay.
And I don't know how much. But
okay.
Yeah.
Okay. So perfect. Do you drink any other beverages throughout your days?
I sometimes. Well, I typically have beer and wine in the evening.
Okay.
Yeah.
How many glasses would you say?
3 to 4.
Of each, or just 3 to 4 glasses in general?
In general.
Okay.
In general.
Do you find yourself getting up in the night to urinate?
Yes. 2 to 3 times.
Okay. I'm sorry. I know that can be really hard and frustrating with your sleep.
Yeah, definitely.
All of that. Okay. Finally, I'm going to kind of just take a look at your skin, which I've kind of been looking at as I've been doing your assessment.
Sure.
I'm not really noticing any abnormalities with that. All of your skin seems to be intact. It doesn't seem like you have any rashes or bumps or bruising anywhere. Do you have noticing any rashes, any bumps anywhere, any odd moles that you've seen? Nothing like that? Good. I'm glad to hear it. So I'm going to move my assistant again and take a seat next to you. Yes. She gets a little grumpy. She really likes to help with assessments.
Oh, I imagine.
So now I'm just going to talk to you. We're going to kind of move from the body, kind of towards more kind of just your mental well-being and your mental state. Because those definitely play in with each other.
Mm-hmm.
So I'm going to just, a lot of these questions are very personal.
Mm-hmm.
And none of them are meant as a judgment.
Okay.
I just want you to be as open and honest as you can, and that way we can kind of come up with a plan that is the most holistic for you.
Okay.
And takes everything that in your life into account.
Sure, I understand.
So my first question for you is: do you feel safe at home? Do you have any issue? Do you have any worries about anybody hurting you?
No, I do not.
Okay. Good.
Yes, I do feel safe at home.
You do feel safe at home. Good. I'm very glad to hear that. Do you feel like you have some depression? Or any depression going on?
Yes.
Do you know what has been contributing to that, or has it just been kind of a multitude of things?
I was divorced recently, and my wife and son moved out, and so I've been living alone. So yes.
Okay. I'm very sorry to hear that.
Thank
Divorce
you.
Is always very difficult.
Right.
Have you been seeking any counseling or anything to help through that?
No.
Okay. So I definitely have, if you would be interested in resources of somebody you can kind of talk to about this.
Sure.
Tell me a little bit about where you work and what you do for work.
I'm an accountant, and I work here in Portland, Oregon.
Oh, great. Do you find your job to be stressful?
Definitely this time of the year. It's tax season. So this is the time of the year where anxiety skyrockets as well as distress. So.
Absolutely. Right. I can absolutely only imagine how stressful this time of year is with everybody coming in to get their taxes done.
Right. So lots of deadlines.
Yeah, I'm sure there are. Do you do anything to kind of help alleviate that stress?
I used to hike a lot, and that helped, but of recent, no, not really. Right.
And then do moving kind of onto more of like the social history.
Sure.
You said you live alone, is that correct?
Yes.
At this point. Okay. Do you tell me a little bit about your sleep habits? So you told me that you get up a couple times in the night.
Mm-hmm.
Do you feel like you have difficulties falling asleep? Do you have trouble staying asleep?
Yes, definitely. And I think the anxiety, I'm worried about my job. The divorce is always on my mind. And worrying about that just makes me worry more about having another heart attack. So everything, it just compounds my concerns. So yeah, absolutely. I definitely do have a hard time with those.
And I definitely can understand that's a whole lot of things for one person to have to feel and go through. So very sorry.
Oh, that's okay.
So you said you like to hike. Is there anything else that you do to help decrease your anxiety?
I hike. I do smoke. I do smoke. So that kind of helps. I know it's not healthy, but I do smoke. But hiking did help.
Can you tell me a little bit about how much you smoke per day and of what?
Sure. I smoke cigarettes typically during the day, maybe 3 or 4.
Okay.
And in the evening, I typically have a joint.
Okay. Marijuana?
Yes.
Okay. All right. So one of my recommendations I am going to bring forward to you is to maybe consider stopping smoking.
Yes.
Smoking has been significantly linked to a lot of cardiovascular disease. And so I know that smoking has kind of been helping with your anxiety and to decrease some of your stress level.
Right.
I'm going to come in after the physician sees you and give you a couple other recommendations on how to decrease stress, and maybe we can hopefully can help you get off smoking as well.
Sure.
I'll bring in as well some resources
Okay.
that will help you with that.
Okay.
So my next question for you is, do you consider yourself to be a religious person?
No.
No. Do you find yourself connecting spiritually in any way? Do you practice mindfulness or meditation of any sort?
Hiking for me was kind of my spiritual outlet. But I've always wanted to try yoga.
Excellent.
Right.
I've never have done yoga before,
No,
but I've always wanted to try.
Right.
So, those all sound like, that definitely sounds like something that we might be able to help you with. So I'll kind of look into all the physicians in here. I'll look into what I can help you with there.
Sure.
Do you have any other questions for me at the moment?
I do not.
Okay. Well, I'm going to go ahead and step out. I'll let the physician come in.
Okay.
And I will be back when after he's all done. I'll be back in. I'll have some information about if he's going to give you starting on any medications,
Okay.
as well as a couple recommendations for kind of how to help you with that anxiety
Sure.
and stress.
Thank you.
So you're welcome. Hi there.
Again. Yeah.
How are you doing?
Oh, I'm okay.
Good. I'm glad to hear it. Did your meeting with the physician feel like it went okay?
It went very well.
Good. Did you feel like he answered all the questions that you had?
He did.
Excellent. I'm so glad to hear that. So I see here that he has a couple medications that he's going to start you on.
Okay.
The first one is lisinopril. Lisinopril is going to help to bring your blood pressure down.
Okay.
Your blood pressure was elevated on admit or on your visit here today. In addition to when you were in the hospital, you also had some elevated blood pressures.
Okay.
Today you were 160 over 95, which is definitely what we consider in the hypertensive or high blood pressure range.
Sure.
So lisinopril should hopefully help to bring that down a little bit for you. So kind of our goal range, we'd want to see your blood pressure. Usually they consider what the most normal is kind of 120 over 80. So that's kind of where we're going to hope to see you with this new medication.
Sure.
The other thing he's going to go ahead and start you on is Lasix. Lasix is a diuretic, and it should hopefully help to move a lot of that fluid that's in your cells into your vasculature so that you're able to filter it through your kidneys and urinate it out.
Okay.
This should really hopefully help with some of the edema you were noting in your feet, and it should help with some of that extra fluid that's in your lungs that's causing that shortness of breath for you.
Right.
This should hopefully happen, relatively quickly after starting it.
Okay.
So you will want to make sure that you're taking it in the morning.
Right. Otherwise, I'm up all night, right?
Exactly.
Okay.
Yeah. You want to make sure you take it right around breakfast time, but usually no later than 4 o'clock.
Got it.
Because otherwise, you do definitely run that chance of getting
just
up
urine.
multiple times throughout the night. So
Sure.
definitely, my recommendation would be to start it to take it after breakfast.
Okay. I can do that.
And then some of the other recommendations I have for you, to kind of just help decrease that anxiety and stress that you're feeling in your life, is to have you maybe consider using aromatherapy in your office, as well as having a little bit of aromatherapy in your bedroom.
Okay.
Lavender and mandarin or citrus scents have really been shown to not only help with like pain in people, but they decrease anxiety and stress, and they both can help a little bit with insomnia, which it sounds like you were having a little bit of trouble falling and staying asleep.
Definitely.
So we will, my recommendation, I have a couple of shops that you can go, and they have different kinds of diffusers that will fit for whatever you're looking for. Some are machines that you can set up that will just disperse the scent. Some are little like bases that you can have a scent in, just to
Okay.
get a little scent of it. But definitely having it at work might help, especially being in that stressful environment of having to get everybody's taxes done and stuff. So having that nice scent coming through, that can really help to make you feel a little less anxious and a little less overwhelmed.
Sure.
And then at night, like I said, that it may very well help with aromatherapy. The aromatherapy may very well help kind of keep with your insomnia and help keep you asleep a little better.
Okay.
My next recommendation for you is to hopefully get you to start hiking again.
Okay.
You know, I know that you said you used to hike and it was very good for your mind and your soul
Mhm.
when you were out doing that. So to maybe have you start looking into some easy hikes around town to start doing that again. We live here in the beautiful Pacific Northwest, and there are tons of hikes everywhere that we'd be able to find for you.
Okay.
I've given you a list with your discharge instructions of some hikes that are relatively easy. You shouldn't get too, you said you're walking okay, it's just when you start that brisk walking and
Right.
like hard, like, you know, a little bit harder physical activity that you start to really get that shortness of breath.
Right.
So these are some relatively easy hikes that hopefully will help you kind of connect with nature again, you know, and bring kind of a little bit of that peace and serenity to yourself.
Great.
And those, like I said, I have in the discharge instructions for you.
Okay.
And as you know, as we continue to, as you start the Lasix, you know, so putting some of the medical therapy back into this, the Lasix, as you get more and more of that fluid off of you, you're gonna hopefully start feeling a lot more better,
Okay.
and you're gonna be able to maybe start taking a little bit harder hikes because your lungs are able to, you know, they don't have as much fluid on them, so you're
Sure.
not going to get as short of breath, and your swelling
Oh,
hopefully
that
will
would be
decrease.
that would be wonderful.
You know, so that is something that we're really hoping for you. But at least to start with some nice easy hikes.
Okay.
And then the third recommendation I'm going to have for you is to start maybe trying to do some yoga.
Okay.
We have a yoga program here at the hospital for patients who've been in for a number of different things, and to maybe start attending that once per week.
Sure.
And my hope is that, you know, you can maybe find some serenity and peace through yoga. It's really been shown to help calm and decrease stress in individuals who have practiced it, in addition to helping with mindfulness and helping you feel more connected to the world around you.
Okay.
It's not very high, it's a very kind of low
Impact.
thank you very much.
Uh-huh.
That was the word I was looking
No,
for.
you're okay.
A very low impact activity that you can do.
Okay.
So, you know, it's not going to really exert a whole lot.
Or hurt my legs a whole lot.
Yeah,
Okay.
and I think it would be very, you know, it'd be a great thing for you to try. So maybe to try to do that once a week, in addition to maybe trying to hike once a week, and having the aromatherapy brought into your, you know, your spaces that you find can kind of be a little stressful for you.
Sure.
Will hopefully help to decrease some of the anxiety you feel.
Great.
And you know, hopefully lead to you feeling a little bit better.
Great.
How does it sound that if I give you a call a month from today and I'll follow up, see how the medications are going for you, in addition to see how these, you know, kind of sign up some of these modalities that I just talked with you about are going.
A month from today sounds wonderful.
Excellent. Well, we will plan on that. Do you have any other questions for me?
I do not.
Okay. Well, and if you have any other questions along the way, if you have any questions about the medications you were given, or, you know, about how to use aromatherapy, or what else you can use it for, or, you know, other hiking places, or,
Sure.
you know, some more about other yoga places in the area, please let me know. I'm happy to help you with that.
Okay. Thank you.
All right. Well, it was a pleasure working with you today. Thank you so much.
Thank you.